Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
How are you, Nita?
Great. How are you?
Couldn't be better because I am living it up.
Yay. Well, we want our listeners to live it up, and they can do so by calling right now and talking directly to you at 866-870-5752. And when you call the program today, you get your free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate.
Hey, by the way, who wrote the foreword?
Suzanne Summers.
Yay, Suzanne Summers, we love you.
We do. And she wrote a new book called A New Way to Age. And guess who's there?
I think there's a chapter she wrote about me and the work that I do in regenerative medicine using platelets and stem cells. So thank you. Thank you for covering this. She did it in great detail. I've worked with her for endless years, and we've been able to heal her and her family. And she refers a lot of people too. She's been referring to me for, 20 years or more. Her son used to be a bicyclist, and I think they had an intervention in the family because he used to get injured all the time falling off of his road bike.
Oh, no, that's
Poor
wild.
Bruce. Bruce, we love you too. You're a good man. But that is a dangerous sport, and I was out to dinner last night. This is a great story with my daughter's boyfriend and her parents. We never met them before. It was a great night. And so he likes to ride bikes, the dad. And the wife was asking me, do you think that's safe? Meaning, would you please tell him not to do that anymore? He's getting older.
That's funny.
And, yeah, some of the worst injuries I see really are biking, unfortunately, because it's a great sport. Because going over the handlebars usually leads to a shoulder separation. A lot of people get hit by cars, and a lot of people wear out their knees and their hips and all that stuff too, or get neck pain from leaning over. But there's no sport I know that's free of injury. I mean, people say golf isn't an injury, but probably 20-30% of my patients are actually golfers, and they come in with injuries from head to toe, which is wonderful in terms of doing regenerative medicine. We can heal just about anything on the body for musculoskeletal orthopedic pain, from the top of the head, neck and back, shoulders, sometimes headaches if they originate from trigger points from the back of the head or down the neck. That's very common. But then, elbows and muscle strains, tendinitis, wrist pain. I had wrist pain. That was my first actual injury, which I had golfing many, many, many years ago. By the way, I'm going to give out the phone number to start getting some calls coming in, and I'll continue the story. If you want to reach me right now live, the phone number to the studio is 866-870-5752, 866-870-5752, and I'd love to talk to you. If you're shy, I hope you're not shy, because we're nice people here. We love our callers. But if you are shy, you can use a fake name, or you can pretend it's about your mother, your father, your son, or your daughter, or just a friend. And you can call the office. That's 800-300-9300, 800-300-9300. And we have people in the office answering phones all the time. If you get a no pickup, just leave your number. We'll get right back to you. Also, another way to get a hold of us is through the website, which is www.lastemcells.com. That's www.lastemcells.com. And there are videos of me doing these procedures of regenerative medicine, injecting with stem cells or platelets or both. And they're very, very safe procedures, which is cool. I get people coming in all the time with what they call bone-on-bone arthritis, which is really sort of an acronym for I'm going to cut you when it's not needed. And the reason I started this story about my daughter's boyfriend's parents, who we had dinner with last night, is he's an avid biker. He just got back from Aspen, and he biked 3 days in a row. And then he was sitting next to me, and he said, I think I might need a surgery because I definitely have bone-on-bone in my knees. And I started laughing. And I said, how could you possibly have bone-on-bone if you're biking that many days? And you hike, and you do all kinds of things. He's a very, very active guy. And he said, well, I don't know. My surgeon told me I have bone-on-bone. And I said, you couldn't do any of those things if you had bone-on-bone, because that means the cartilage is gone. And when cartilage is gone, the joint doesn't move because it's very rough. The bone is rough, and it can't move. So I always use the analogy of take two bricks and put them next to each other and try to make them slide. It doesn't happen. So this thing called bone-on-bone generally is a lot of, what's a good word I could use, Nita, on the radio? Can I say BS?
Well, it's a it's a myth. It's a myth, and it's kind of like an
myth.
old wives' tale.
It is, and it's a way to shuffle people into surgery. The doctor looks at an X-ray or MRI, and they see what they think is bone on bone. They see decreased joint space, meaning the cartilage is worn down. But that doesn't mean you have to have a surgery. And there are a lot of people that have cartilage that's worn down, and they work out forever, till the day they die. And they don't even have pain. And we know this because there are many studies that show that when you look at an MRI, you can't determine from that whether a person has pain or not. We do MRIs of people that have no pain at all, and we see terrible things, and we know that the MRI is not the problem because the person has no pain. You tell them they have loss of cartilage or a meniscal tear, or they have a meniscal tear, or a rotator cuff tear in the shoulder, herniated disc in the back, and you tell them that they may want to see a doctor about that, and they go, why would I? I don't have any pain. So don't get lost in what a doctor tells you. It's what Nita calls the myth of medicine. I like that. I'm going to use that. It's the myth that we're looking for you have pain, we're looking for the reason. Oh, there it is. Let's operate, when it usually is not the problem. So we need to find the pain generator, which means we need to do an examination and move the body around, take a great history. And unfortunately, most of the people that come in to see me with failed surgeries, which is almost every single day, I ask, did the surgeon ever touch your body and examine you? They go, no, they didn't. They didn't touch me. They showed me the MRI. They slapped it up on the light box and showed me where the problem was. And then they did the surgery and told me it was going to get better, and it got worse. So I love surgeons. I'm going to say that. I just don't like all the musculoskeletal surgeries they're doing that they shouldn't be doing. Okay? That's my opinion. You don't have to believe me. But I'm sure most of you have friends who have had surgeries where they failed. I'd say it's a 50-50 shot. And then people say, well, I had a surgery and it worked. And then I hear from years later and they go, well, it worked for a year or two, and then it didn't work. And studies also show, let's say you have a knee surgery, or you don't, and they're compared. At 2 years, you're the same whether you have the surgery or not. So why take the chance of having the surgery? It makes no sense. So the phone number again to the studio to talk to me and learn a lot about your condition with musculoskeletal pain is 866-870-5752. I'll repeat it. Go grab your pens. Give us something fun to talk about. 866-870-5752. And to call the office, 800-300-9300, 800-300-9300. The website is www.lastemcells.com, and I've set it up so every single page has a spot where you can email me personally, and I respond to every email every day. I'm up early doing emails, and I'm up late doing emails, and in between patients I'm doing emails. So I get emails from all over the world, and I love communicating with people. Another thing about communication is I give out my cell number to every single patient who walks in the door, and my email, my personal email address. I like to stay close with my patients and know what's going on with them. If something happens to them, I want to know about it immediately. Okay? I don't want to wait. So I'm going to go, actually, Anita, I'm going to talk about a couple other things. One is, besides doing musculoskeletal issues in the office, we also do hair regeneration using platelets and stem cells. And we also do something called the vampire facelift. So it's nothing scary. It's very simple. It's just, numb up the face with some numbing cream, and then you can inject platelets and or stem cells into the face to regrow the collagen. And that's what regenerative medicine is all about. It's regenerating the tissue. It could be the joints, ligaments, tendons, anywhere on the body, or it could be the face or the hair follicles. It can be done on the top of the head too if your hair has started to thin. So it's pretty amazing to me. I've been doing this work since about 1997 during my residency at UCLA. And it's been a miracle for my body, as all you folks know who listen to me, or my patients who are listening know. I am the walking testament to regenerative medicine, because I've been doing it on my body for over 25 years. And I'm a hardcore athlete, and I'm repetitive, and I do continue to injure myself. And when I do, I just inject myself. And so far, every single part of my body that I've worked on, my wrist was the first, my shoulder was the next. And my shoulder, as you know, was a surgery during med school that turned out real bad. And then I didn't know about this stuff then, but then about 3-4 years later, during my residency, UCLA, there was a lecture on it, and I learned about it, and I injected my wrist. And actually, I had another doctor inject my wrist the first time, and it was about 50% better the next day. And then I injected a few more times, and I've had no problems in umpteen years. I can play golf, or I can do whatever I want. And then I did, after that, my shoulder, after the failed surgery. And then I've done both my knees, both my elbows. I had injuries in my elbows at different times. Really, it was mainly from golf, hitting on mats. If you go to the golf range, it's not real smart to hit on mats. It's better off on the grass, because the mat is on top of concrete typically. So when you're thinking about slamming a club at 100 miles an hour into the ground, that's not good for any part of your body. So try to hit off of grass if you're going to be playing golf at the range. I always tell people that have injuries in golf, please stop going to the range for so many hours, because that's what I would do. I loved repetitive shots. I would go to the range for hours and hours, and it beat my body up pretty bad. But I'm back at it. I've had no wrist pain, no elbow pain, no shoulder pain now for a long, long time. I do have a knee injury, which I created myself, which I'm always experimenting, and I used a product of hyaluronic acid on my left knee, and it blew up real quick, and my thigh is still swollen. I'm not going to give that to anybody. I know a lot of doctors do, but there are allergic reactions, and for the good of my patients, it happened to me instead of them, and I'm still working on that one. It's getting a lot better. So, Nita, any words of wisdom before I move on to some questions here?
No, go ahead and hit the questions. Maybe give the phone number and the website first.
Okay. The phone number again is 866-870-5752. And I'll repeat it to the studio right now, 866-870-5752. And to my office, 800-300-9300. So here's the phone. Oh, this is good. This is on par with what I was talking about. It says bone on bone in my right hip and will need a complete replacement. Well, that will is not the right word, most likely. Person says, I'm 79. I've had 2 surgeons tell me I'm bone on bone in my right hip and will need a complete replacement. I would prefer not to do that if there is a viable alternative. In reading your information on the 4 case studies, Those are studies that we did in our office. I guess they're reading my book, which, by the way, if you call in, we're going to send it out for free postage, everything. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got a foreword by Suzanne Summers, the beautiful actress who's still cranking like crazy, still working, still going to Vegas, doing her thing. And it's got about 265 studies or so on why you don't want to be doing surgery for these things and why regenerative medicine is really a very good thing. It's been studied quite a bit. We do studies in our office. We have a lot of students who come in ready to go to med school, and doing the research, putting their names on papers that they work on, helps them get into medical school. So we've had endless students come in that work with us, that shadow me and do research. So if you get the book, if you call in, you'll get the book for free. You can look up the studies in there about hips and shoulders and knees and all that stuff and how this stuff works. So they say, I am not clear if after treatment with the injections, an X-ray would show regrowth of cartilage. So the answer to some of these things, let's see. Well, number one, I'm mentioning again, bone on bone, when you hear that from a doctor, doesn't mean a darn thing, because a lot of people have cartilage loss, but they have no pain. Okay, so don't look at, because you have some pain, you tweaked your knee or your shoulder, your hip, whatever it is, and you have some pain. That doesn't mean that because of the arthritis you have, that you're going to need a surgery or that the arthritis is causing the pain you have. There's a lot of reasons in a joint to have pain, many of which are not related to arthritis. In other words, a lot of people have arthritis and have no pain, and they don't even know they have arthritis until they hurt themselves and they get an MRI or an X-ray, and the doctor goes, whoa, you got arthritis, we got to go ahead and do a joint replacement. So I treat hips all the time. I treat every part of the body. There's nothing I don't treat. I do necks and backs and hips and shoulders and knees and toes and fingers and ankles and you name it, I do it. Muscle tears and tendon tears and whatever it is, tendonitis, tendinosis, the whole body. So do I know if I can help this person from this question? I don't know, because I haven't examined this person yet. So if you want to come into the office at 800-300-9300, that's the office number, I can examine you. I can tell you in a minute whether doing stem cells or platelets is going to help you and which one would be most viable for you. So the person says, would an X-ray show regrowth of cartilage? It's not relevant. The question's a great question, but it's not relevant, because you can have very little cartilage and have no pain. So if we grow some cartilage, does that matter? Not necessarily. I know this is confusing for people, because if you're a very analytical person, you want to see that cartilage growth. I have seen it many times. Most people don't want to get another MRI or X-ray after they feel better. I ask them to, and they go, why would I want to? I already feel fine. I don't really care what it looks like. I have seen it for the few people that have gone in when I've asked them to get second images so we can compare. And after a few months, we can see sometimes a regrowth of cartilage. The joint space increases. So what do you think, Nita? Anything special you want to say? I don't want to leave you out of the mix here.
Well, I think it's all good information, and I think that whole myth about bone on bone, I was just looking on Google, and there's tons of stuff on it, and it's connected to inflammation, but it doesn't mean you have to roll into surgery.
Well, that's the thing. I mean, when you have pain, it's usually from inflammation, but that doesn't mean you have arthritis or something you need surgery for. So you have to be very careful about that.
I love when you train people to get a second opinion from a different kind of physician.
Absolutely, because if you go to one surgeon and he says, like this person, he went to two surgeons, and they both said he needed a hip replacement. You can go to 20 surgeons, they're going to tell you the same thing, because that is the culture of what they do. So if you want to find out something different, a different type of opinion, Go to someone who does something different. Go to someone who does regenerative medicine. You'll get a better idea. And it's very important when you go to a doctor to find out how experienced they are. If you go to someone who does regenerative medicine part-time or once in a while, they're not going to really know the answers. You want to go to somebody who does it all the time, every day, all day long. Or you might get the wrong answer because they don't really know what's going on. So you got to be careful with that. May I take another question, Nita?
Let's do it.
Let's do it. Let's see here. This one says, husband has bulging disc and lower back and a surgery was suggested. Well, of course it was. Hello, my husband was referred to you by a friend who is your patient. Husband has bulging disc and lower back and a surgery was suggested. We're hoping you can help. By the looks of your webpage, you're a very busy guy. Yes, I am. When is the soonest we can get to see you? Well, I'm going to actually call you up after the show. I see your cell number here, and I will get you in whenever you want. I can always slip a patient in, even when we're slammed. We're hoping you can help. By the looks of your webpage, very busy, blah, 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 blah. When is the soonest? Okay. I'm assuming he has an associate who sees the overflow. Nope, I do it all myself so far. I am looking for another doctor who knows this kind of work. So if you know of anybody, send them over. I would love to get an associate and get them all trained to do my work. I am a little bit too busy, but I do it. We live in Thousand Oaks, not too far away. My office, by the way, is at Wilshire Boulevard near the 405 freeway, across the freeway from UCLA, where I did my residency. So here's the deal on a bulging disc. Doesn't mean a darn thing. Okay? Most people as they age get bulging discs. Does it cause pain? Nope. So why, when someone has a bulging disc, would a surgeon tell them they need surgery then? Don't ask me. I don't know.
Wow.
Are you silently laughing,
Well,
Nita?
I'm in shock because, I mean, you know, it's nobody's fault. We just don't have the information.
Well, I have the information, and doctors do have the information, and my book has all the information.
Well, I
has all
mean,
the
the
studies.
public doesn't. That's what I'm saying.
The public doesn't, that's right.
Yeah.
And if you get a diehard dinosaur doctor, they're going by old information. They don't follow up on their own research that's in the industry. And bulging discs generally do not cause any problems. Now, if you have a disc that's blown, you know, it's extruded, and it's really pushing on a nerve that goes down the leg, and your leg is dead or on fire, that's a problem. Sometimes, and sometimes not. That doesn't mean you run to surgery. A lot of times when someone has back pain and leg pain, once I fix the back, the leg pain goes away. And sometimes there's chiropractors who can straighten out the back, even when there's a herniated or extruded disc and the leg is flaming up with terrible pain, that can straighten out the back and get rid of that disc pushing on a nerve. And there is a good buddy of mine, his name is Randy Weinzoff. He's in Santa Monica at, I think it's 2020 Broadway, who I send all of my leg pain or arm pain people to when it's called a radiculopathy, when I can't help them. So he's a good guy to see. If you come to see me for back and neck pain and you have a radiculopathy, and I work on you and get rid of the neck or back pain, and you still have the extremity pain, I might think of sending you to him, just so you know. I'm not against chiropractors. I love chiropractors. I go to them myself. I see Randy every once in a while when I tweak myself. Now, if you guys saw my back, you would, if you saw x-rays and MRIs, you'd go, whoa, you need a surgery. I have no back pain now. Nothing. I have something called DISH. DISH is a syndrome where there's over deposition. Ooh, hang with us. We're going to go to the break. Call us live, 866-870-5752, 866-870-5752.
You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab her pen or a pencil and write down this information, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.